We bring in our 9 health expert, Dr. Payal Kohli, also cardiologist. Heart disease, the #1 killer of men and women, and that means we just got to wake up. Statistically, many of us are going to get it, and many of us are affected by it.
It's so true, and many of us don't know, especially women. 56% of them don't know that heart disease is the #1 killer. But in medicine, we sort of had it backwards. We used to wait for symptoms from heart disease, wait for the heart attack, the shortness of breath, the chest pain, and then think about treating it. So now we really flipped that on its head and said we need to get ahead of heart disease by starting to treat people in their 30s and 40s, preventing the disease before it manifests itself.
For many people, it's asymptomatic. They will not feel that they have heart disease. So that's why it's important that you are with your doctor, and your doctor can probably find a clue or two.
That's exactly right. It's not going to tap you on the shoulder until you have that heart attack. In fact, we heard last week from Mike Kliss about his family history of heart disease and how he never saw a cardiologist. And you know, I'm a little biased, but in my opinion, you don't have to have heart disease to see a preventive cardiologist because you want to get ahead of it. And the way we get ahead of it, Tom, is to get blood tests, but also now we have a test called a calcium score, which everyone over the age of 40 should get. It's an X-ray of the heart that tells me whether you already have like tiny blockages or medium-sized blockages that are not yet causing symptoms.
And when you think about it, whether you want to bury your head in the sand or not, if something happens, you're looking at a life-changing event sometimes.
A life-changing event. And we're talking about heart disease, but stroke is part of cardiovascular disease. And you know, most people say they would rather die than have a stroke, and yet we have strokes happen every single day. So the fact that you can prevent 80% of heart attacks or strokes, to me, today is not just about awareness, it's about empowerment. It's about saying, I'm taking control, not the disease.
Let's talk about alcohol, because we just finished dry January, and it used to be that saying, you know, alcohol, certain drinks, good for the heart. What are the current recommendations, though, when it comes to alcohol and heart health?
Yeah, we used to say alcohol in moderation, 1 drink a day for women, 2 drink a day for men. Now we're saying no amount of alcohol is recommended. Now, having said that, all of us enjoy a glass of wine from time to time. So if you want to drink wine, you want to try to limit your alcohol intake to less than 2 drinks a week, and that's men and women, because that's when we see the inflection point with the risk of heart disease, cancer, gastrointestinal disease, all kinds of problems starting to increase.
Well, while you keep taking me down, let's talk about diet.
So diet's
I'm
huge.
giving you 2 drinks a week.
Okay, all right.
Saturday and Sunday.
Okay, let's talk about what I have with my glass of wine.
So every single plate should be heart healthy. And there are 2 types of diets, the Mediterranean diet and the DASH diet, that are actually proven to reduce heart disease incidence, heart attacks and strokes. So imagine not having to take a pill, changing your food so that you can actually prevent disease. And the way you can do that is by making sure every single plate has half fruits and vegetables. That's breakfast, lunch, and dinner. A quarter is a lean protein, chicken, fish, tofu, an egg if you want to eat in the morning without the egg yolk. And then a quarter is a whole grain, so some kind of oatmeal or some brown rice or quinoa. And you do that, that's this part of life's essential 8. You do these 8 things, and you are talking about a life free of heart attacks and strokes, not just for us, but for the generations ahead of us.
Makes a big difference.
It does.
It's a huge difference.
Well, we wear red today, and hopefully we think about it beyond today and continue to try to stay heart healthy. And we always appreciate you coming in and joining us and teaching us. Thanks for doing it. Dr. Payal Kohli joining us today.